In the Woburn study, I would say at the end of the day, there was still uncertainty about whether there really was an association. The odds ratio for prenatal exposure was very high. It was eightfold, but it was not statistically significant. So you'd have to look within the data to see if there was a dose-response trend, which there was. But again, it was based on modeling of exposure that happened 10 or 20 years prior. There was a subsequent or an additional analysis that asked questions about how many glasses of water did the mothers drink during their prenatal period. All of that is open to error and misclassification, recall, bias, and so forth. So I think at the end of the day, it's hard to say there was a causal association established in Woburn. It was certainly a statistical association in respect to the dose-response trend. But how much further than that one can go is open to question. And again, in court, where this would have come up, had this study been a topic in court, the standard is really more likely than not, rather than beyond a reasonable doubt. So epidemiologists, I think, and especially when we use the p less than 0.05 or 95% confidence interval as sort of a decision rule, I think we would have to say that it was a mixed story with respect to the usual epidemiologic conventions. Whereas in court, a physician who was actually testifying about an individual patient, a child who died of leukemia, or there was one adult actually who had been exposed and died of leukemia, I think there the physician can make a judgment based on ruling out from their medical records any other possible causes, family history, in the case of the children, excessive prenatal exposure, or in the case of the adult, other occupational exposures. So that would make it possible, I think, for a physician to say, well, ruling out these other things in this patient's life, the most likely explanation, in fact, may be contaminated drinking water. But that's a different setting and a different set of rules, I would say, than what epidemiologists typically use.